age of 18, when their brains are still developing, and continue to use into adulthood, experience as much as an 8-point decline in IQ scores. There is also evidence to show that marijuana use can cause a host of other problems. Third, injuries and deaths from impaired driving will increase. Marijuana use affects coordination, decision-making, and perception, which directly impacts impaired driving. It is the most prevalent illegal drug detected in impaired drivers, fatally injured drivers, and motor vehicle crash victims. A recent meta-analysis of 9 epidemiological studies concluded that drivers who test positive for marijuana are more than twice as likely as other drivers to be involved in an accident. 5 years after establishing a medical marijuana program, California saw a near 100% increase in fatal crashes where at-fault drivers tested positive for marijuana. Accidents, liability, and insurance rates for employers have increased. Marijuana use adversely impacts employee performance and safety, which are major issues for businesses and industry. Safety, absenteeism, turnover rates, tardiness, productivity, work quality, and liability lawsuits are all concerns for employers in the 21st century. A study found employees who tested positive for marijuana have 55% more industrial accidents and 85% more industrial fatalities compared to non-users. Employees who abuse drugs are 4 times more likely than non-users to injure themselves or others and cause 40% of all industrial fatalities. A study showed that those testing positive for marijuana had absentee rates 75 times higher than non-users. Businesses are less likely to stay in a state or come to a state where drug-related risks are high, and in this case, our country. It also has a negative effect to our health, contrary to what doctors say. The executive director of the Trinidad-based Caribbean Public Health Agency, Dr. James Hospedley, told a panel discussion on decriminalization and legalization of marijuana at the Caribbean Tourism Organization State of the Industry Address in St. Thomas, West Virgin Islands, and I quote, "Legalization or medical use of smoked cannabis is likely to pose significant public health risks, including an increased risk of schizophrenia, psychosis, and other forms of substance abuse disorders. We already have 2 major legal substance abuse, alcohol and tobacco, which cause a tremendous amount of harm. According to the American Lung Association, marijuana contains 33 chemicals that are known to cause cancer, and due to the lack of filters on the joints, deposits 4 times as much tar into the lungs as an equal amount of tobacco. Marijuana is also a gateway to health problems. Marijuana introduces multiple toxic chemicals into the user's body. In addition, marijuana is also a gateway to crime. I have mentioned the negative effect it has had in the United States. Do we really want that to happen to our still developing nation? Do we want to become a nation of unproductive, unhealthy, uneducated junkies? I would think not. Our brave forefathers fought to get this nation to where it is today.